What do you think are the key takeaways for physicians that are working actively with patients based on these studies? What can they apply to their day-to-day decision making when it comes to treating patients?
First, inform your patient about the disease, inform your patients about all options available in the specific country. And then make a shared decision making with the patient. What are your treatment goals? What do you want to achieve? And consider the opinion of the patient. And then you will have a good compliance because the patient was involved in the decision making. And then use molecular monitoring as optimal as possible. That means 3 monthly in most cases, and consider the results of molecular monitoring for your decision making. That means if you don't achieve an optimal molecular response, you may look for the reasons for that. Maybe compliance, maybe side effects which are behind. That means we need the communication with the patient in this case, and consider the alternative options. If alternative drugs are available which overcome these compliance issues and tolerability issues, then you should use them. And if the patient wants to achieve treatment-free remission but is not in deep molecular response, you can switch a therapy to have an alternative drug available which may result in a better PCR response. We use the communication with the patient, we use BCR-ABL level, we use the side effect profile, and we use the mutation profiling to select the best available therapy at the specific time point.
Do you have any final thoughts that we haven't covered just on CML in general as you're, at the conference, things that have stood out to you as far as what your colleagues are working on that you're excited about?
My colleagues ask me, what about current recommendations for CML management? And we just finalized the ELN recommendations for the management of CML, and we cover, of course, treatment options, but also diagnostics, monitoring options here. And this paper has been accepted by Leukemia last week and will appear very soon in leukemia, and therefore we have a guidance how to manage CML patients worldwide based on these recommendations from an expert panel with 34 colleagues. I think that's a major impact on the management worldwide. But of course, on the local level, and you mentioned this already, each country has specific situations. And in Europe, we don't have the first line registration for asciminib for the time being. We are waiting for this, but we produced local guidelines, for instance, in Germany as well, to cover the current situation, and these local guidelines will appear very soon. That means the field is evolving rapidly. Therefore, we need to update these recommendations again and again. I think after the first line registration, we should do working on the recommendations again to implement the first line use.
Thank you so much for your
Good,
time.
thank
We're
you.
looking forward to the next phase of the study.